Hi, everyone. I'm Alex from Hornet, and I'm so excited that you could join us for this segment that we're doing for AIDS 2020, the virtual conference. We're talking today about tech and HIV. It's a really important topic. It's also a very large, comprehensive topic, so we're going to try our best to cover as many topics as we can today, and we have a great panel of people to help us get through some of this. So I'm going to ask each of them to introduce themselves and share a little bit about who they are and the work that they do. So I'm going to start with Jesus.
Awesome. Thank you so much for inviting me. I'm actually really honored to be a part of this conversation. My name is Jesus Gregorio Smith. I'm an assistant professor of ethnic studies at Lawrence University, and my work and research kind of focuses on the intersections of race, gender performance, and sexuality online, and how those kind of impact mental health and sexual risk behavior. So yeah, very much excited to be a part of this. Thank you.
Great. So why don't we go to Sean Batir? We have two Seans today.
Hi, everyone. My name is Sean Batir. Nice to virtually meet you, Jesus. And thank you, Alex and Sean, for hosting this. So my name is also Sean, and I'm the director of AI at a company called Outco, where our vision is to basically enable all existing software engineers to learn machine learning and also to just ultimately get people jobs in the tech sector, whether or not they come from a background that didn't give them access to the appropriate education or the tools that they needed when they were younger. I'm also sort of a senior ML engineer at the innovation lab within a large automobile company. So I sort of both work on the high level as well as the low level, thinking about AI, how do you implement the systems, and actually collaborating with other partners as well as building it out myself for business use cases. So excited to be having a conversation with all of you today.
Brilliant.
Great. Thanks so much. And our third participant is Sean Howell. And Sean, before you introduce yourself further, I want to say that this segment was done in collaboration with Tech for HIV. And we're very excited that there is an organization that is prioritizing all the opportunities that exist between technology and HIV and bringing this epidemic to an end. So, Sean?
Yeah, I'm Sean Howell. I'm the co-founder of Hornet, and I currently chair Tech for HIV, which is the alliance of private sector companies in the tech space looking to leverage the tools that they have to better equip the HIV response. Companies like Microsoft and Google are members of that alliance.
Great. So technology is something that we're constantly hearing about. It's certainly in the news in relation to COVID, and it's always been an issue that's been close to our response to the HIV epidemic. So I think the first place to start is from each of you, if you might be able to provide some information or perspective on how you see technology working to better our response to HIV, whether in terms of prevention or treatment or any sort of interventions or initiatives that really can utilize technology to better our response to the epidemic. Sean, why don't you start?
I'll go.
Okay, go ahead.
Yeah, no. This is such an interesting topic because I currently have a paper under review at AIDS Behavior with a colleague of mine, Gabe Amaro, and we are even kind of exploring this idea of what does it mean about the sort of behaviors that might take place online. And some of the research is so inconclusive, right? Like some of it is like, well, online provides more risk and more opportunity, while others suggest it doesn't. And so I think the question is so fascinating because it does speak to some stuff that I think is inconclusive that we need to have some clarity on too. I think that one of the things that I like that Hornet does, and Grindr's attempted this, and different websites have attempted this, is having these sorts of conversations in their websites or on their web pages where these sorts of discussions can take place. I think even opening the venue for that kind of conversation helps in some of the preventative measures that can be taken by people. And I think having that conversation needs to happen. So I think, again, when these websites or these geosocial apps provide that space, that can be a really great avenue for breakthroughs.
When we talk
Alex,
about technology, I'm back. Sorry, I was muted. There's plumbers in the background. So when we talk about technology, there's all sorts of different ways that technology impacts our lives. And so there's the technology that most people are familiar with, which is sort of online internet applications. And then there's the much more sophisticated elements of it, like AI and all of the other sort of tech that most people may not know they're interacting with on a daily basis. And I think both Sean's certainly have a sense of those types of things. How do you see those things impacting the response to HIV?
Yes,
So
maybe just, oh, go ahead. Go ahead, Sean.
So when I think about technology, I really think I think about the opportunities, and I think the HIV response, much of it is so analog. You know, we have 40 million people, or 37 million people living with HIV. We're adding 2 million every single year. And our ability to reduce costs there hasn't played out. We see total costs increasing over time. We have more and more need. You know, the vast majority of HIV cases go untreated. And those cases that are untreated, there's often economic stigma and discrimination at play. And so what tools do we have at our disposal to kind of combat that? And being a software guy, that's what comes to mind, because software, once it's built, there's no additional cost to add one more user to that software. And so any place in the HIV response, we can introduce some software, we're going to be able to scale the response. And so much of healthcare is often dealt with in kind of this analog way. One patient with one doctor and one being treated at one time. And I think from a patient perspective, if you think about the things that they really want, you know, maybe they work in the evening or they work during the day and they can't go to the doctor's office. So how can we reach the people who aren't being reached? And I think there's a democratizing element to software that decentralizes things, gets out, destroys power hierarchies, and is disruptive. And that, to me, is a whole opportunity that exists in the HIV response. And that conversation, I think, is just beginning. So I look forward to anyone who this inspires to talk about that further.
Yes, and as a hook on to what Sean had mentioned about how he views like software to be a tool to democratize a lot of this AI, as well as building on what Jesus had earlier said about sort of the geographic benefits of using these apps to access resources that are closer to you. I think what's interesting is we're living in this time where both off the shelf as well as emerging technology products and services, you know, things that can provide AI and machine learning capabilities. These truly have like the potential, Alex, to transform both not just the quality, but also the quantity of HIV data across the entire response cycle. And if we have that data at these different time points, we can actually also reduce inefficiencies. We can improve our outreach and service delivery. And it can ultimately actually lower costs, making it, again, more scalable and more tractable, and no longer something that is so difficult and which has typically relied on coordinating purely people. And this, you know, I guess links to this soft concern that people have about AI, which is it going to replace jobs? And, you know, one of our greater visions is that AI augments humanity, like that it augments our cognitive capabilities and ultimately our ability to help each other. Yeah.
So it's such an important discussion to have around technology, particularly now when so many questions come up, questions that have been coming up for decades, right? How do we get technology to work for our communities as opposed to against our communities? And I think that much of the approach from technology, particularly in the health sector, has approached it from a neutral setting, as if technology were neutral. And we've seen over and over again that technology is informed by the bias of the people who create it. And so the question becomes, particularly in this moment we find ourselves in, both with health disparities and disparities in regards to access to care and employment and all of the racial injustice that we're seeing played out again and again. How can technology work for our communities, particularly those that are the most severely impacted?
So maybe to just address that question about how technology can address communities and work with us rather than against us, it's important for us to be mindful about how we begin and formulate the problem at the very beginning. And so to clarify on what I mean by that, at the end of the day, a lot of these AI and ML algorithms, it's learning a pattern that's intrinsic to the data. And so that data that's going to learn from is going to have some inherent bias already. So it's a job of humans to actually act as stewards and to actually shepherd this initial seeding process of whatever alien AI mind or ML algorithm that we bring into this world. It's essential for us to have that human element of discrimination. And so a good example of this that I actually teach in some lectures involves if you took a corpus of hospital data from just the 1950s to the 2000s, and you were trying to build a classifier that predicted people's jobs based off of their name. Well, today, we're fortunate in 2020 to see almost equal, even more representation of women in medicine. But if we used historical data, which is typically how a lot of these algorithms are trained, over time, it will actually learn the bias of the data it is fed. And so that's one of those steps where if you just blindly implemented a classifier, you would end up creating arguably a sexist AI. But the objective is, since we all have knowledge of our cultural past, and we also have a vision of where we want to go, then it's our job to actually either increase or decrease the weights of certain priors and certain data artifacts in order to ultimately allow this newer reality that we are collectively developing to unfold. So that's my response. It's basically that we need to discriminate it at the initial seeding point.
Sean, Jesus, do you have something to add to that?
I just think that, you know, if you have technology that's being introduced the way anything is built today, with user experience at the forefront, you're putting the needs of the customer first. And I often think that's just divorced from the approach of healthcare. And so I think putting a technology lens on healthcare will help it. I have a bias in that boat, but from what I can see, I often don't see that being done. And if you think of like MSM care that's offered, you know, often it's, you know, it'll be put in the gay center of a city, and I think that's great because you can feel comfortable in that part. But what about all the, you know, the 50% of the gay men who live in a different part of the town, and how can we reach them? And I think, you know, online, there's just endless possibilities, and we're just scratching the surface at serving the underserved communities.
Yeah, and I just want to, I'm actually really happy about this question, Alex, because the first thoughts that I had were about, and both Sean's addressed this, about like algorithms of the oppressed, right? And just sort of how, especially how you both kind of spoke to the biases that seep into all of our work in different ways. So I'm so happy to hear about the opportunity that's there to actually make so many vast improvements. I also think this is an interesting political question in many ways too, because I think about access and what that means, and that's much more of like, how do we get this sort of AI and this sort of technology out to people? Because just COVID in and of itself, I'm seeing here in Wisconsin, especially rural Wisconsin in particular areas, when students had to go home, especially students of color, they were in rural towns where they didn't even have access to internet. And so it's interesting to think about how much opportunity could be there. And yet the political question of the day is, how do we get more access to areas that are still historically stratified?
Well, technology is also sort of always rested on the fundamental notion that, or assumption that people have access to it, right? When we talk about things like reaching MSM through apps or on their phone, it's presumed that they have a phone, a smartphone, and they have this app. So I think part of it is being creative enough for us to step back and say, where does technology not exist? How can it be brought in, or doesn't even, are there places where it doesn't need to be? And then I think one of the more pressing questions becomes, how do we anticipate when technology might be used to do harm? And by that, I mean, a good example, I think, is what's happened in South Korea around contact tracing and using technology and targeting gay men specifically. And we know how gay men are targeted globally by using technology from governments or from others. Are there ways, sort of creative and smart ways, that technology can be used to defend against that or anticipate that so that it can't be as effective when used by bad actors?
So I think with the contact tracing, the way that's being rolled out most times is they're not going out to a way, it's not being rolled out in a way that public health actually likes. They're doing this decentralized method because there is this lack of trust from citizens. And I think whether it's public health or even technology companies, that trust is a little bit eroded. And I think one of the ways to build that trust is to look at ways we can introduce software in a responsible way, in a way that serves the community. But I think it's scrutinized, not because of there's justification for that scrutiny over the years. So I think software is powerful, so it can be used for good, it can be used for bad. And it makes me sad when we're not seizing an opportunity. But I think there are elements that are super important, because both HIV and gay sex are criminalized in more than 70 countries in the world. So we have some very serious issues. We need to move to criminalization. If we want to take advantages of software, we also have to think about what other laws and human rights issues we have to put into play.
So I think that also, to me, raises this question of how can those of us who are working either for LGBT rights or for social justice use technology as a tool against the oppressor, for lack of a better word, these institutions that are meant to deny us our rights or our humanity. And I think one example, one sort of maybe an old-fashioned example, but things like the Arab Spring could not have happened had technology and things like Twitter not been in place to help move it along. So when we think about sort of where we are now, and the coming years, granted things change so quickly in a week nowadays, are there things that each of you in your experience see as sort of key areas of focus that probably need either more priority or more investment, but you think that could really make an investment and an improvement on the health and wellness of gay men?
I want to speak to this a little bit. That's a really excellent point, Alex, once again. And it makes me think about Michael Tiger Mandingo Johnson, right, in Missouri. And I just think about his story and how much that really exploded the discussion around HIV criminalization once it picked up steam on Twitter, right? So actually using technology to get the story out further, because this is, again, a small town, which we see a lot of criminalization take place in these towns and a lot less powerful enactment against that. And so I think you definitely bring up something that I think is really powerful in the way that we can bring attention to certain issues quicker to probably people who are really important, who can actually help us and aid us in different ways. So I think that's one space that we can see where there's a targeting and there's a vulnerable population in which, yes, we have used and we have seen technology actually work to our benefit in that situation.
Yes, and also just as a hook onto that, it's an interesting question because, again, I think I'm hearing a lot of words about like targeting and empowering to be revolving around this topic, and I think a good place to begin is also like, how does targeting occur in the first place? Again, like it comes from seeding the ML or AI algorithm with data, and I think one of the reasons why people feel so mistrustful about AI and why people feel like they are being targeted is because partially they just don't know that they're being targeted. And so erring on sort of the side of disclosure, I think is one of the key elements to making this a little bit more tractable and accessible. For example, like it's been known that about, I guess in a recent Gartner report, I was just in a work meeting before this, 2018, like I think 80% of companies surveil their workforce by basically taking random snapshots of your laptop. And that is expected to actually be increasing during COVID time. Now, if I didn't know that my company was doing that, I would be extremely terrified and mistrustful. This isn't even AI, it's just surveillance. But if I like knew, like signing my contract, like, by the way, we are like a cybersecurity company, so this is just something we have to do. If you know that's what you're signing up for, then you're less likely to have this inversion of belief and therefore feeling like you were targeted because you already know that you've engaged in this. And I think that's a little bit of that spirit that we're beginning to see as of 2018 with GDPR, people saying like, oh, we use cookies. But the issue there too is like most people don't know that when you like check like, oh, I know that you use cookies, you're also signing away some of your data because it just seems so inconvenient and you just want to use the freaking website to read an article. So yeah, I think disclosure is one of the key elements and maybe fundamental principles to at least softening the blow of feeling targeted when an algorithm or a software is used in either for or against you.
Aside from COVID, the other bad thing about 2020 is all the GDPR disclosures that we have to check, ignore every morning. Yeah. But I think, if the question is how can we use technology against bad actors instead of having bad actors use it against us, you can think about some of the hottest technology that exists right now. And putting AI aside, one part of that is just cloud computing. And so what can we do in the cloud as activists? And we can organize. And it allows us to work globally and together. And so that is one of the big opportunities that exists for activists. It's just the things we can leverage from software. And I think, at every conference about HIV and activism, we should be talking about the tools that we have. We should be doing workshops on them. And we should be empowering new leaders who are competent in this. And it should just be another thing that people learn, just like back in the day, like how would you organize a rally? How do you organize a social media campaign? So I think there's some work to be done on the activist side to grow that competence.
And it's such an important consideration because there's such a lack of investment in precisely what you're talking about. So right, when HIV organizations get investments from large global companies or even from local companies, they have a very small byline about technology. It's usually sort of a standard thing, but it isn't a more sophisticated, nuanced understanding of how technology is going to be super important for them to accomplish their objectives. One example, sort of interesting and I think to some people potentially controversial example of technology in the context of gay men recently, and I think Sean, you may have posted about this, Sean Howell, is the Welcome to Chechnya documentary where facial technology was used to reveal members of this very vulnerable population. And so I think a lot of people have visceral reaction to the sort of facial technology that we see happening all over the place. But this ended up being a really good example of how you were able to keep people safe. And as we talk about vulnerable communities in the context of LGBT and HIV, there's a growing vulnerable community. And so are there other ways similar to that that might be useful in terms of addressing their vulnerabilities? And is this current example, might it be heading us down in a dangerous direction, or is it something that works in our favor? Any thoughts on that? Sean, I think that you talked a little bit about sort of using facial technology and sort of recognition of patterns. So is that something that we should be worried about? Is that something that we can take advantage of? What are your thoughts?
Yeah, so I guess the reason why I'm a little like leery on answering this question is because this, again, it's sort of like thinking of technology like a tool, right? Like it can be used for both good or bad. And I think the question really becomes in whose hands is it deployed? And then it ties to Sean Howell's response, which is like, we can best safeguard against maybe the unethical use of these AI algorithms or these tools by educating people at the earliest stage. Ideally when kids are still young, but for people who are currently controlling world orders, for us to just sort of be very transparent about this, you know, at the highest levels. Like, you know, this can be a tool for incredible good. If I can track when a patient's body position is indicating that they're, I don't know, maybe at increased risk of death or complications, you can save lives. But also the same software or tool to identify like the outline of a human being can be used for smart weapon tracking and remote assassinations. So again, the tool can be used for in many ways and in many purposes, and it's ultimately effective. It's just who is deploying it, and can we sort of safeguard ethical considerations around it at the time of assignment.
Which is why I think the philosophical question there is really important, kind of what you're pointing at to underlining here, right? Like philosophically, how do we feel about who is in what position and for what, and what the use of the technology is for. I think that it's such a fascinating discussion in so many parts because, yeah, I think of the Black Lives Matter protests right now and how many people are speaking to the fact that they're being tracked because they're being recorded, or different things like that. And so activists being afraid of that and what that means, especially during Pride, where you're having queer liberation marches, and that's bringing back queer riots, and what that means when you're targeting people who have multiple marginalized identities. So I think, yeah, philosophically, it's such a good question to really wrestle with. But I do think that, as both Seans have spoke to today, like the opportunities for good quite possibly may outweigh the possibilities of bad. And this is one of the best conversations I've had about this. And so I've always been weary of that, but you two have really helped me think about how much opportunity for good could be there. So I think that it's saying something. I also want to speak to your point, Sean B, about just being upfront about things is so important. We've learned in public health, for instance, that just telling Black people about the really racist history of public health and medicine actually made Black people want to be involved in medicine more. And so I really applaud this idea of just being kind of upfront actually makes a really big difference. And so pushing that narrative of transparency, I think, can really, really help in the long run.
And I would add to that, I think that policy also becomes a really important part of this, because policy is made without technology often being considered. And so it falls on us, unfortunately, to really push to ensure that policy takes all those things into consideration. So as we move to wrap this very interesting and compelling conversation up, one, I want to thank you all again for participating in this. It's a really valuable conversation that I think we can have a dozen more of them. And the last question that I will pose to you, if you have thoughts, quick and brief thoughts, is there any technology that currently exists or that you think is sort of in the pipeline that you see as sort of your favorite, best example of something that is working for our community, working for for gay men's health. Is there anything that stands out to you that you think people should be aware of or look out for?
I just think that everything that you would ask for your own healthcare, we can build with a gay and HIV lens on it. And people should be able to get an HIV test whenever they want. They can, whether they need to go into a clinic and book it online or they get it mailed to them. That it should just be as easy as anything you could shop on from Amazon or Instacart and just get it done. And we need to make things accessible and cheap. And that can also be counseling. I mean, we can certainly scale up counseling online. And if and I think the measurements that we do, I think we need to get better at measuring how well the services are working for the community. We often count success all the time, but in truth, maybe we're not. And I think here we can have better indicators to know that, we're not serving the majority of gay men. We're certainly not serving the ones who are most vulnerable. Gay men of color, low income, sex workers. We just leave so much of the community unserved or underserved. And there are, we should be looking at what our growth metrics are. And these are, the things that tech companies think about. And I think often we end up counting the same, that we're testing the same people as success.
And yes, and also to address that, I agree with Sean in saying that we should be building these algorithms, keeping in mind the sort of LGBT community and our context, but also to link it back to what you had asked, Alex, about what are some existing tools today that I think might be effective in addressing or safeguarding this. Two companies that come to mind are also two companies I believe to have the nascent capability that makes us also intrinsically human, and that is the art of discernment. As humans, we can use data, even as you said earlier, Jesus, if you showed African-American people about the history of discrimination in hospitals, it's actually motivated them to now want to participate in hospitals because they have more information, because now they can discern. And so how do we make machines also be able to discern and have that sense of judgment? And I think two companies that just pop up to my mind, and I've either worked with them or am considering working with them, include Affectiva, which focuses on emotional AI, as well as Anduril Industries, which is actually a defense contractor. And you might be a little confused as to why I would have such opposite companies. Well, Affectiva is interesting because it's using computer vision to identify emotions in people. And by being able to identify and label emotions in people, that allows us to discern and condition our behavior about whether or not, if someone is sad, will I tell them to do 500 more problems, or will I be more empathetic, right? And so that's a clear case for emotional detection. Now with Anduril Industries, they are building a surveillance system, but what makes them unique is that their surveillance system may be activated only when specific sensors are also activated. And that's a sense of discernment, right? One of our concerns was that you always have perpetual ubiquitous surveillance. But if you have a unique context, only particular situations where maybe a specific space is under threat, then you activate the surveillance. That's a sense of discernment, because now I'm not just broadly applying it across all people or populations, but only under certain conditions. And so I think these are two forms of technologies that are both incredibly powerful and I think helpful for us, as long as they remain sort of in the right hands and whoever is working with it has a sense of discernment.
Jesus.
Hopefully they hire a gay man as a senior engineer.
I can't really speak to as brilliantly as you two about the future of this or some stuff that's that we should probably push to the forefront, but I can say that good old geosocial technology is working really great in a lot of ways and doing a lot of great things, because I am seeing a lot of access and opportunity to discussions around pre-exposure prophylaxis, right? That's happening for certain people in ways that never happened before. Knowing that a lot of men who have sex with men might not necessarily be out, it's providing a lot of anonymity that people need. And so even that is helping in some ways because it's allowing people to still have access to resources that they never had before, have certain discussions that they never had before, and still protect their identities in some ways. And so those good old, mobile apps are still pretty good right now.
They're great. Everyone can be on them right now. So I want to say thanks again to Tech for HIV for helping host this. Thanks to all three of you, and catch up on everything that's happening at AIDS 2020 and the virtual conference, and we will see you all soon. Thanks again.
Thank you, everyone. Nice meeting you.